Good afternoon, everyone. Thanks for having me. So throughout this segment of the presentation, I will focus on the following: defining social determinants of health, helping you to understand what determinants may affect a patient's health, describing tools used to assess resource needs, and helping you to prepare your patients for their medical visit. So what are social determinants of health? The World Health Organization defines them as conditions in which a person is born, lives, works, and ages. What impact do social determinants of health have on what impact do social determinants of health have on the health of a patient? If we take a look over here to the right, notice this man's genetic makeup. 40% of his life is impacted by socioeconomic factors, while 10% is affected by his physical environment, 30% by health behaviors, and only 20% impacted by healthcare. So what do social determinants of health look like? Well, it's your family's income, it's your ability to travel to and from, i.e. your transportation. It's your access to fresh food and clean drinking water. So just how healthy is your community? I have listed here annual rankings of how health is influenced by where we live, learn, work, and play. If you notice, Anne Arundel County has a health outcome rate of 10 out of 24. This means out of 24 counties in Maryland, Anne Arundel County has placed 10th as it pertains to health factors such as social and economic factors, clinical care, and the physical environment in which a person lives. So tools such as these help community health workers to do the following: raise awareness about factors influencing health, helping us to initiate community assessments and planning in areas of concern. And these tools also help us to revitalize existing community health improvement strategies. Now let's take a look at our test patient. Miss Anexa is a 71-year-old. If we take a look at her social profile here, she is a retired widow who lives alone with no family nearby. She has a high school education. And take note that Miss Anexa has recently been hospitalized, and at this time, she has no fresh food in her home. So we just discussed a few social factors that could affect Miss Anexa's health. Which social factor would you say is of highest importance to address first? Please answer via the poll on your screen.
Thanks for those who've locked in their answer already. If you haven't, please take some time to click on the answer that you think is correct for this poll.
All right, thank you for your responses. Thank you, Angelica. So as we can see on the screen, 72% said food insecurities was of highest priority to address first. Housing came second, social interactions and transportation were tied for third. So if we look back at our presentation, food insecurity is actually going to be of highest priority to address first from a community health worker standpoint. And as we think back to Maslow's hierarchy of needs, without addressing a patient's basic needs, their other needs are no longer of priority to them. And food insecurities is a physiological need on Maslow's hierarchy. Now, as a reminder, MDPCP requirements state that practices should complete an assessment and conduct an inventory of resources as it pertains to social needs. The requirement also states that practices should utilize the health-related social needs screening tools. So now that we know what social determinants are and how they can impact a patient's life, let's take a look at a workflow for addressing these social needs. So a typical day in the life of a community health worker would start off by receiving a patient's referral. The CHW would then outreach the patient and conduct some baseline assessment. Community resources are then shared with the patient and periodic check-ins are scheduled. When all of the patient's needs have been met, the case is then documented in the EMR and the case is closed out. Of course, there are instances, however, when the patients cannot be reached or all of their needs have not been addressed. This will sometimes result in what's known as a home visit. And home visits, if we take a look at the bottom of our screen, are sometimes prioritized by a PCP or CM request. They are sometimes scheduled when we are unable to get in touch with the patient, when the patient may have some safety issues, if there is a need for in-person assistance with completing applications, just to name a few. So what goes into planning the home visit? And I just want to make note that due to COVID-19, virtual visits have replaced home visits in most instances at this time for community health workers, but we will still talk about what goes into planning these visits, whether they be virtual or face-to-face. So you first want to establish what the visit is for, i.e., is this going to be an initial assessment or is this going to be a follow-up visit? You then want to establish a protocol for your visit and identify safe practices for staff and patients. You want to establish protocol for addressing social needs, such as which assessments will you complete, who is your patient's PCP, and will you be able to schedule these appointments for your patient? You then want to move forward with establishing measures for reporting the data that you have collected. Now, over to the right, we have an SDOH wheel that highlights the categories of concern based off of the patient's responses to the social determinants of health assessment that a community health worker would complete. This is the tool that's used in an EMR that identifies barriers to care, and as you can see, it color codes them by priority. So if we remember back to Miss Annex's highest priority being food insecurity, we see that it is highlighted in red as high priority for the community health worker to address first. So another responsibility of the community health worker is sometimes to prepare patients for their upcoming office visits. And again, due to COVID-19, some office visits are being, as you already know, rescheduled or transitioned over to virtual visits in the form of telemedicine. So here I have listed some helpful tips that community health workers are using to best prepare their patients for their upcoming doctor's appointment. And I listed a stat on the side of our screen here. If we pay attention to the data at the bottom, 74% of telemedicine users had their care concerns resolved during their first visit. So these telemedicine visits are definitely effective according to this data. Now, the next two slides are handouts that are going to be attached to the handouts that you have received today if you would like to use them. These worksheets are worksheets that can be shared with your patients to help them prepare for their upcoming visits with their doctors, whether it be a telehealth visit or in office. And it just helps the patient to identify important details that they may want to write down in regards to the appointment. Any thoughts or feelings that they're having, just things to remind them to go over with their provider. So listed here are examples of screening tools used to identify and address social barriers. Just to go over a few, we have the CMS Health-Related Social Needs Tool. This is a tool that's comprised of 14 questions ranging from family and community support to food and transportation access. Then we have the American Academy of Family Physicians tool. This is a tool composed of 15 questions and aimed at 5 core health-related social needs. We then have listed the Prepare Toolkit. This toolkit is made up of an assessment that includes 15 core questions and 5 supplemental questions. And the goal truly in the Prepare Toolkit is to provide users with resources to best prepare them with implementing some data collection and responses that we received to social determinant needs. So that's just to name a few of the screening tools that are available. And also, as a reminder, conducting an inventory of resources is an MDPCP requirement. So here I have listed some resource libraries and directories that are available that community health workers are using pretty much daily, and patients are also available to use along with their care team. So just to go over a few, we have United Way 211, and this is a free and confidential service that helps people across North America find local resources 24 hours a day, 7 days a week. Aunt Bertha is an online resource library that connects patients, hospitals, community health staff with resources to better manage a patient's social needs. And Maryland Access Point is the Aging and Disability Resource Center aimed at providing some individual person-centered counseling to those that are seeking referrals, information, and program support. So just to go over a few. Now we've discussed what social determinants are and how they're best addressed. Let's focus now on the individuals addressing these issues. So on your screen, I have listed here the role of the community health worker. And as we know, we are now facing a global pandemic. And since about March 2020, the role of the community health worker has shifted. So instead of just increasing access to health services, as a community health worker normally would, they are also acting as community level educators, organizers, and mobilizers during this time. Instead of just communicating important public health concepts as they normally do, CHWs are contributing to disease reporting systems for things such as contact tracing. And while CHWs are still definitely focused on reducing the burden felt by healthcare, they are also completing medical tasks unrelated to the infectious disease outbreak by doing a number of things such as educating on safe practices and symptoms of COVID-19. In addition, here are a few examples of ways that CHWs are supporting the community during COVID-19 through food and grocery delivery, appointment scheduling, PPE creation and delivery, and unemployment assistance. On this screen is a list of resources available for health workers during COVID-19. I want you to place your focus on the third resource listed here as Dia de la Mujer. This is a set of recorded webinars aimed at promoting self-care support for community health workers, which, as you can imagine, is very important during a global crisis. So that is a resource available for health workers during COVID-19 for anyone that would like to take a look at these webinars. Okay, so after discussing what goes into addressing social determinants of health, would you say your primary care practice has resources or services available to help patients address their social needs? Please respond to the poll on your screen by answering yes or no.
Right, we have about 10 seconds before we close the poll.
All right, thank you, everyone. It looks like 88% said yes, they do have resources or services available to assist in addressing social needs, and 12% said they do not. So thank you all for your responses. For those of you that said that you do not have these resources or services available, I'm hoping that some of the resources that have been shared during this presentation will be of assistance to you, and they are also available via your handout. Okay, so as another reminder, a MDPCP requirement also states that practices should convene patient-family advisory councils. A patient-family advisory council is defined as a group of staff and volunteers. Volunteer patients and families collaborate with employees, as you already know, to provide guidance on how to improve the patient and family experience. So in order for the Patient Family Advisory Council, or also known as the PFAC, to be fully functional, the framework must consist of the following: establishing and maintaining a PFAC, ensuring patients are meaningfully involved in the design of care, communicating to patients and their caregivers about the changes implemented by the practice, and regularly reviewing patient data with PFAC and assessing how changes are improving. So what goes into establishing the PFAC? And as we already know, a lot of services are being transitioned over to virtual services. So here we have listed what goes into establishing PFAC virtually. And you first want to start off by establishing the scope, i.e. the size and attendees, and inviting potential participants. You then want to move into setting up the meeting at a convenient time using a virtual platform. And a plethora of topics can be discussed during this PFAC, whether it be virtual or face-to-face. Topics sometimes include patient safety and experience, and or patient and family education. You then want to communicate office changes based on the patient and caregiver feedback that may be faced. Review data to improve the patient experience, and measure and assess improvement to be implemented based off of the PFAC. So just to recap, we have defined what social determinants of health are, and they are defined as where a person is born, lives, works, and grows. We've defined the requirements of the MDPCP program to include practices completing an assessment of social needs and conducting an inventory of resources, and utilizing health-related social needs screening tools. We've reviewed support and resources available for community health workers during COVID-19, and we have discussed what a Patient Family Advisory Council is and the requirement for the MDPCP program. And we have also discussed the framework necessary for the PFAC to function. Thank you so much for your time. I will be available at the end of the presentation for questions.